Today, I stand firmly in support of the establishment of a national health insurance program in the United States. Our healthcare system is both the most expensive in the world and one of the least equitable among wealthy nations. Despite spending nearly 18% of our gross domestic product on healthcare, millions of Americans still lack access to even basic services. Families routinely choose between their bills and their healthcare. Seniors ration their medication, and working adults, delay care because they simply cannot afford it. These are not isolated stories. These are everyday occurrences in which Americans choose whether to pay their bills or buy groceries or pay for their essential medical care. A national insurance program offers a clear, achievable, and urgently needed solution. I'll demonstrate the harms in the status quo, demonstrate why these harms will persist without federal action, present a plan, and explain the advantages of adopting that plan. So, what's wrong in the status quo? There are many harms that Americans face when making their health care decisions. Millions of Americans lack coverage. Even with the Affordable Care Act, roughly 27 to 30 million people remain uninsured. Millions have insurance so limited that they avoid treatment because they can't afford their deductibles. When people pay or delay, when people delay or skip care, their health worsens and costs increase for everyone. Medical debt is a widespread crisis. Healthcare costs are so high that medical debt has become the leading cause of personal bankruptcy in the United States. A healthcare system that punishes people for getting sick is not functional or acceptable. The system is inefficient and wasteful. Private insurance companies spend enormous amounts on administrative overhead, billing departments, marketing, profit margins, and complex paperwork. This all adds up to hundreds of billions of dollars every year. This fragmented system drains resources that could be used for actual care. Employer based insurance is unstable and leaves people vulnerable. Most Americans get their insurance through their jobs. When people lose their job, they often lose their health coverage, exactly when they need care the most. The sudden loss of coverage increases medical debt, delays treatment, and worsens health outcomes. Job lock keeps people in jobs they'd rather leave, which ends up hurting workers and eventually our economy. High prices create an access crisis. The U.S. pays more for prescription drugs, hospital services, and medical procedures than other countries. Insulin, chemotherapy, drugs, and basic medications are often priced out of reach. Even insured patients face copays and deductibles that are so high they avoid care. High prices and lack of access directly cause preventable deaths and chronic disease progressions. Rural healthcare hospitals are closing at alarming rates because reimbursement is inconsistent and often inadequate. Rural residents travel for hours for basic services or end up going without. A national health insurance would stabilize funding, provider participation, and prevent further collapse. The US has dozens of insurance systems: Medicare, Medicaid, employer plans, ACA plans, private plans, military plans, charity plans, and uninsured plans. Each has different rules, deductibles, networks, and costs. The complexity results in errors, surprise billing, denying claims, and coverage gaps. The more fragmented a system is, the more people will fall through the cracks. Preventative care saves lives and money, but millions skip it because of the cost. Without preventative visits, small healthcare problems go into expensive, dangerous emergencies. Treatable conditions like hypertension and diabetes become life threatening. National health insurance would promote early intervention. Doctors and hospitals spend enormous time and money dealing with insurance companies at prior authorizations, billing codes, denials, and appeals. Administrative tasks contribute to burnout and shortages among healthcare professionals. A unified insurance payer would reduce that burden, improving provider efficiency and morale. There's total inequity in mental health coverage. Mental health treatment for chronically ill persons is undercovered by private insurance. Private Patients, face limited networks, high out of pocket costs, and shortages of providers who accept insurance. National health insurance ensures comprehensive mental health care with coverage on par with their physical health program. So, why won't this program fix itself? Private insurers have built in conflict of interest. Insurance companies maximize profit by limiting coverage, raising premiums, and excluding high risk patients whenever possible. They're not designed to provide universal coverage, and they never will be. States can't solve this problem alone. State budgets are constrained, and state level reforms produce inconsistent results. One state cannot finance universal coverage or negotiate national drug prices on its own. Current programs, as I said before, are fragmented. Medicare, Medicaid, insurance from employers, marketplace plans. Each covers different people under different rules with different costs. No combination of these programs can guarantee universal access. Only comprehensive national reforms can close these coverage gaps. So, what will the affirmative side do here? The United States federal government, through Congress, will establish national health insurance. This will guarantee health insurance for all U.S. residents. The program will be funded through a combination of progressive taxation and payroll based contributions. Individuals will continue to receive care from existing health care providers, public or private. This program will cover essential health services, including preventative care, primary care, emergency services, hospitalization, and prescription drugs. A new division within the Department of Health and Human Services would coordinate these benefits, negotiate prices, and reimburse providers. Provider participation would be required for receiving federal reimbursement. All residents would be automatically enrolled. The plan would be financed through a combination of proven revenue sources, which would be reallocation of existing federal and state healthcare spending, elimination of private insurance administrative waste, employer payroll contributions that replace private premiums, which would allow businesses to save money and move that savings throughout the system. And if additional revenue would be required, it would come from modest progressive taxation on high income households, not working families. This plan would create a simple, universal, and efficient insurance system. The advantages of this system are pretty simple: improved public health through universal access. When everyone has insurance, everyone can access early diagnosis, preventative care, and treatment before conditions worsen. Countries with national health insurance consistently show better outcomes in life expectancy, chronic disease management, and maternal health. Economic relief and greater efficiency. A single nationwide insurance program cuts administrative overhead, saving hundreds of billions of dollars annually. Healthcare providers spend less time on paperwork and more time on patients. Businesses also benefit by having no longer being burdened with providing employee insurance, allowing them to invest in wages and growth. Our current system reinforces inequalities based on income, race, geography, and employment. Our national insurance would ensure that healthcare access is based on medical need, not financial means. Rural communities benefit from stable reimbursement. Low income families and marginalized groups gain access to quality care. This plan advances fairness and ensures that healthcare is a human right. In conclusion, the US system leaves millions uninsured and perhaps families in medical debt, wasting extraordinary amounts of money on administrative complexity. These harms will not change without federal action. This affirmative plan establishes national health insurance, a system that expands access, increases efficiency, improves public health, and uh, creates more than just society. For these reasons, I urge you to consider an affirmative position. The United States already spends enough to fund national health insurance. The problem isn't a lack of money, it's a lack of efficiency. By redirecting existing spending, eliminating wasteful private insurance bureaucracy, and replacing employer premiums with predictable payroll contributions, and using progressive revenue only when needed, the plan is fully funded while lowering total national health care spending. This means the question isn't, can we afford national health insurance? The question becomes, how long can we afford not to?